The gentleman from Fairfax, Mr. Simon. Oops. I want to see if you can still run. Gentleman from Fairfax.
Mr. Speaker, I rise for an introduction.
Gentleman has the floor.
Mr. Speaker, members of the House, in the gallery, you may have noticed we have some folks in some brightly colored shirts there. They are advocates, catch my breath, from New Virginia Majority, SEIU, the Virginia Interfaith Center for Public Policy, and Progress Virginia. They're not just advocates, though. Excuse me. Many of the people that are in their gallery today fall into the coverage gap that we've talked about here and that we'll have an opportunity to address a little bit later on this morning. If you all rise for a second so that folks can see that you're here. One of those folks is Keith Oliver. Keith is 30 years old and works part-time, so he doesn't get employer health insurance. In 2013, Keith had a mild stroke and was admitted into the hospital, where he spent 12 days that left him with a $400,000 hospital bill. 12 days in the hospital cost him more than he could make in 16 years. The stroke also left Keith with limited mobility that required physical therapy. Luckily for Keith, there was a charity group that was able to cover 5 physical therapy sessions, but that wasn't enough to regain full mobility. The physical therapist working with him told him that he would need at least another 2 weeks of aggressive physical therapy he just couldn't afford. Keith still deals with recurring health issues that really should have received that medical attention, but he can't afford it. Not long ago, Keith was admitted to the hospital again for 2 nights with a very high fever and other health ailments. This hospital visit cost him $11,000. Keith works hard, and he plays by the rules, and he deserves to have access to affordable health care. We also have with us Brittany Norfleet from Louisa. Brittany was diagnosed with a rare disease called synovial chondromatosis, which causes her severe leg and knee pain. She's incurred over $1 million in hospital bills from surgery she's had to have in order to walk. She's been denied Medicaid several times. She is currently on disability because of her disease, but the disability checks are garnished to pay that medical debt. So, Mr. Speaker, members of the House, I hope that we'll consider those stories and those thoughts, and I hope that at the moment we will greet the advocates with a warm House welcome.
We're pleased to have the visitors with us today, and we thank you for your advocacy.